September is National Recovery Month, and Gateway Foundation is teaming up with 26 Illinois hospitals in a campaign to get addiction specialists to people in need. Senior Vice President Teresa Garate tells us how it can save lives.
So Gateway Foundation has been doing the warm handoff program with a number of hospitals for the last 4 years, and we currently are in partnership with 26 hospitals across the state of Illinois.
Yeah, and in all communities, not just the city, but all communities.
Yes, all the way from the north to the south and the central part of the state. And what we do is we place our clinicians, our Gateway clinicians, our certified addiction counselors in the hospital as engagement specialists. And those engagement specialists interact with people presenting to the emergency room or the medical surgical floors as well. Either somebody who has come in a full-blown overdose, or maybe they're going through withdrawal, or if a provider at the hospital identifies somebody that they think might need some screening and assessment around substance use, then our engagement specialist engages with the person. We determine what kind of treatment they need, and then we make that warm handoff to a treatment provider. Sometimes it's a Gateway program, and sometimes it's one of our partners in the community.
Why is it so important to do it at that moment while they're in the hospital?
It's kind of a captive audience, right? So when they're in the hospital, if it is some kind of a detox or withdrawal or an overdose, they're going through a lot of physical pain. And at that time, our engagement specialists are able to do motivational interviewing and really engage with the person and show them and educate them about why it's so important to go to treatment, and that there are treatment options out there, and that addiction is a disease of the brain and can be treated with services like the ones we offer. And so when they're in the hospital is really key.
And these are for people who may ask for services or may not even ask for services.
That's correct, right? So sometimes a provider in the hospital, nurse or physician might say, you know, we think that you should spend some time talking to our Gateway partner. They have some services for you, or they have education. So we initiate the conversation. As I've said before, when I've been here, there's a lot of fear and ignorance, and people don't know what it's like to go to treatment. So having that support right there at the hospital is a really critical and important step.
A lot of infrastructure there to support them. What did people do before this came around?
So, you know, hospitals, obviously, different size hospitals have different resources. We see a huge need across all the hospitals, especially our critical access and rural health hospitals, where we are in the middle of the state. But even our hospitals here in Chicagoland, they're very busy. You know, they don't have time. They might have time to give a pamphlet or a brochure and say, you know, you should go to treatment, call Gateway or call another provider. But they don't have the time, those nurses, those doctors, to really sit with the person and engage with them and spend time with them, educating them about the treatment options and also doing the assessment. So I think before, hospitals were giving out information. Some hospitals, of course, have their own supports. Those aren't really the hospitals that we're in. We're really there in the ones that really need our support.
And what has the response been like?
Yeah, it's been great. So initially, you know, I think hospitals were a little leery about letting us in. You know, they're big organizations as well, and you know, health information needs to be protected. But once we started and could demonstrate that, you know, the impact of this program and the fact that we're engaging with so many people, and about 65% of the people we engage with say yes to treatment, which is a huge number, and it fluctuates, then I think the hospital saw this great opportunity for us to go in. It's no cost to them. It's all grant funded by a grant from the Illinois Department of Human Services, Division of Substance Use Prevention and Recovery. So it's really a resource that we can offer the hospitals.
And people don't have to wait for the warm handoff program. They don't have to wait until they get into a situation where they're in the hospital. They can come and seek treatment or seek advice or help from you guys anytime.
Absolutely. Yeah, we have a 24/7 line, which I know you guys know, and you're going to post on the screen. And we also have our website. And yes, people can come to us all the time. But the hospital is just a great way for us to be proactive and outreach to people at a time where they need it most, where they're suffering the most.
And we're highlighting this because this is Addiction Recovery Month.
Yes, last month on August 31st, it was Overdose Awareness Day, and that was a nice transition into September, which is Recovery Month, and a time to really think about this and also talk and share your stories of recovery so that we can help people not die of this terrible disease.
If you or someone you know is struggling with addiction, you can reach out to Gateway Foundation. The information and their telephone number right there on your screen, 24-hour hotline.